Hello, good afternoon, everybody. Happy almost 4th of July. Thank you for joining us for Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. Every Monday through Thursday, 5 o'clock, Facebook Live, we're bringing you information about seniors and people that could help the senior community. Most of you know me by now. I'm Deirdre Virvo, senior advocate, author, and real estate investor. Just opening my first senior home. I'm so excited about this project in Shelton, Dogwood Senior Residential Home. It is a memory care home for 6 lucky seniors. So if you're interested in getting a tour or talking more about it, please give me a call. You'll see a little ad at the end of the video, and I'd love to talk to you about it. We're opening next week, COVID-free. Your senior will not have to be locked in their own room. We're doing double negative tests and letting people in. Everything is safe, only 6 people, beautiful surroundings. You're going to love it. So today we have a really special guest. Her name is Carol Raitanen. I know I was going to mess it up. Carol Raitanen. And she is the publisher of the Senior BlueBook. This is the guide in Fairfield County to everything seniors. Everything you need to know healthcare wise. If you're looking for an elder care advocate, a senior residence, anything you're looking for a senior, Carol is the gal to show you. And as a special offer today, Carol is going to give you a free book just for calling in or asking in. So I'm going to have her join us now. Hey, Carol, how are you?
Hi, Deborah. I'm great. How are you?
So nice to finally have you on.
Thank you for having me.
Yes, thank you so much. Carol, why don't you tell us a little bit about the BlueBook and how you got started and what you did before this in your life?
Sure. So,
were you always a publisher?
Yes, I launched the publication in 2014. And, everybody seems to have a story when they, find themselves in senior care. And I'm not an exception there. I worked for Greenwich Time and the Advocate, and then the White Plains paper, Gannett, but most of my time in Greenwich. And so I had 21 years of experience selling advertising and working in publishing. And a friend of mine called me up and she said, my brother-in-law wants to buy this publication. It's a senior directory, and he's looking for somebody to publish it for him. And so we talked about it for a couple of months, and it just so happened that at the same time, my mother was in the late stages of her life and going through, all of the things that we see seniors go through when they get to be, 90, 91, 92. And so my sister and I were on a particular day together thinking about assisted living for her or home care, thinking what the best option was because she clearly wasn't okay by herself anymore. And so we were in the car, and she's an RN, and I said, Sylvia, so I'm thinking of changing jobs. And I, had a book from another market. We're, 28 markets nationally. I showed her a copy of it, and I said, so what do you think, as a nurse? And she literally did this and said, do you know how easy our job would be today if we had that book for here? And so that was the deciding factor for me. And it turned out to be a wonderful step in life. It's a very, very gratifying job. I work completely independently. I am now the owner of it. I bought it from the original owner in 2019. I've had it for about a year and a half, and here I am.
So Carol, it is funny because almost everybody I talk to that is involved with seniors has some sort of senior experience with their own relatives to get them involved.
Yes.
Yeah, how easy would your life have been instead of sitting there and trying to figure everything out on your own if you had a guide? So,
Right.
so tell us a little bit about the book. It is a national publication, right? And you have the chapters.
Yes. It's a national publishing company, and Seniors BlueBook publishes in 28 markets nationally. So in the Northeast, there are a handful. There's Connecticut, as I said, Fairfield and New Haven and Middlesex County in one book, and then there's the Greater Boston area. 3 books in the New Jersey market, 2 in Pennsylvania, and then the others are south and west.
Nice. Very nice. So what is in the book and who gets it, who uses it, and what's so fabulous about it? I mean, I know it's fabulous about it because I already have a copy, but tell everybody else what's so fabulous.
Right. So we publish 60,000 copies per edition, and we publish twice a year. So that's 120,000 copies of this book that are out there annually.
Wow.
So when you think of that over a period of now going into our 7th year, there are a lot of books that are out there. And so we distribute with a professional distribution company. I happen to have a new edition coming out in just a few days. It's at the printer now. It will come from Denver, from the printer in Denver, and be delivered next week to our distributor in Norwalk, who I work very closely with. He and I, with every edition, pass this very lengthy list of 1,800 distribution points and fine tune it. If he, in his deliveries, if he's realized that some places have moved or dropped off or whatever, I update that for him, send it back to him. I add new locations. For instance, Deborah and I work together now, so of course, just like home, we'll be receiving copies.
So Carol, is it all doctors and hospitals and nurses and nursing homes, and who gets the copies?
It is certainly senior residences, assisted living communities, skilled nursing facilities, and then certainly senior centers, adult day programs, doctors' offices.
Now, what about regular people? Where can regular person like me find it?
Yes, we also distribute to many stores throughout the 3 counties that we serve.
Okay, and I hear you're giving them for free now, if anybody.
We always do. It is a free publication. It's supported by paid advertising, but the publication is free. And yes, if you ever want to be added to our distribution list, we are happy to do that. There is no charge. You can reach me at 203-303-7400.
Nice.
And yes, I will I'll mail multiple copies if you need them to work with your constituents, or if you need one for your family members, just let me know.
This is definitely must go out to all the senior centers and everybody, because so tell us what's in the book. Do you have a copy?
I do, yes. So this is the edition that we had in distribution from fall through summer. With each edition, I have a photo of local seniors, which sort of tells a little bit about the book immediately, so that when people first see it, they understand what it is about. And to just try to give you a quick tour here. The book itself is color-coded. So you can see that there's a blue section that is community resources, a purple section, which is home health care agencies, and that includes non-medical home care, skilled home care, and hospice care. And then senior housing is the 3rd section. Sorry, I'm going in the wrong direction here, aren't I? There we go. and the senior housing section is in green. And you can sort of see here that the information is in a grid format so that someone can say, look at a particular town, and they can find communities that specifically match their needs based on location, price, size of the community, and the amenities that are available. So it literally is, in my opinion, the easiest way to do comparisons for either senior housing or for home care, because it's the same grid format for both of those categories. So if one were to, for instance, do a Google search looking for home care agencies, they would very quickly realize that it's not specific necessarily to what they've searched for, because it's a matter of whoever bought those keywords that will come up. So they could be sorting through about, who knows, 15, 30, 45 listings before they really find what they need. So this book eliminates that confusion.
So the categories you have are generally housing, like where might you put a senior? If it's a nursing home or in-home healthcare or assisted living categories, right? And
yes.
Then how about all the professionals? Like, does it have doctors? And
yes, the community resources section is anything that is not a category of housing or a category of home care. And those are alphabetical listings, A through Z. So starting with adult day, accessibility, so on and so forth, right through the alphabet. Anything that is.
And it gives you the cost of things and,
well, the resources section doesn't. No, the only section that we ask our contacts with their listings to provide a price is with the housing, because that's obviously very important. With home care, those prices could certainly change within a 6-month period.
Nice.
So they don't list the prices.
So people at a glance can see a grid, because I've seen it. You have it so comprehensive. I wish I had my copy here. But I've seen it. It's so comprehensive because you take the grid and you do it more than once. You'll do it based on these services or based on location or based on, so you can actually compare. If you're like, well, I want something just in the Shelton area. Oh, I just want to compare. I don't really care where it is in the county. So you have all different ways to compare. So you've laid it out very smartly for people that are looking for different things.
Right. I can't take credit for that. It's an interesting story for how this book started too. The history of it is also very interesting. The woman who started Seniors BlueBook, her name is Marian Hirsch, and she lives out in Colorado. And about 35 years ago, she had this friend who was caring for his aging wife. And he was a retired lawyer, and being a very professional, organized man, he collected data, he put it in a book, he shared it with his senior friends, and he did this for a period of many years. And when his wife passed, he decided he wasn't going to, keep the information up anymore. And so Marian said to him, how about if I buy that book from you? And she said, wouldn't it be wonderful if people all over the country had access to the kind of information that you're providing to seniors and their families? And so that's how it started. And then it went, yeah, it is. It's amazing. It's a great success story. She started out with one book in Colorado, and now there are 28 markets. So, and it's growing.
But listen, it is true. If you spend all the time compiling information and you've already used it, it's great to share that knowledge. Otherwise, the next person's reinventing the wheel. So this is very clever, and a clever way to start a business.
So additionally, we're launching a brand new website that's being handled by our corporate office, of course. That should be ready, and the goal is July, but it is July now, and we're not quite ready. So I would say by, late summer, maybe even early fall. We do have a website now, but we're working on making it just a little more user-friendly.
So will everything in the book be on your site?
Yes, it is a searchable website, so you can log into seniorsbluebook.com. You can search any of our 28 markets. You can set parameters for either senior housing, home health, or resources, and you can designate a geography with a radius, and then receive all of the information that's available. It fits your
That's
criteria.
BlueBook.com, right?
Seniorsbluebook.com.
Wow, that is an incredible resource. Also, because, for instance, right now I'm moving. I was sharing with you. I was moving my aunt from New Mexico to Arizona. So, I mean, I'm in Connecticut. So it's great to have the resources. I might have your book here, but I would love to know what's happening with the Arizona book.
Unfortunately, we don't have an Arizona book. Maybe you know someone who.
You're not talking one there, Carol.
That's hard to do from Connecticut. You really do have to, sort of be infiltrated in the market. Maybe you know someone there who would be interested in doing that.
Oh, I could think about that. I could ask my cousins, but it's great if you could. Well, so you're in 28 markets now and growing.
Right. So also on our website, we have an events page. So we allow anyone who is a member of Seniors BlueBook, and you do that simply by registering on the website, and you can add your own events. You put the information in. You can include a JPEG document. Let's say that you are, perhaps not right now because of the pandemic, but in normal times, have an open house, and you're inviting seniors in to see your brand new community. And you are really
on the website.
Yes, that can be put on our website. Yes, and that's free to anyone. That's a free service.
Wow, when is that opening up?
That's available now.
Ooh,
that's been available for a long time. Yeah.
Well, that's great because that also makes it more interactive and gives reasons for people to keep going onto your site to see what's new, not just, the few times they might need it while they're looking something up. They could constantly go on and see what's going on, what's happening, what's new.
Yeah, I would strongly encourage anyone to log into seniorsbluebook.com. Number one, they can look at, the book itself for any market. If they want to do a flipped version of it, they can see the actual pages, or they can search our website for the same information, whichever is more comfortable for them. They can add their events. They can post jobs.
Wow. So do you have any stories that you want to share about people that have used your book with success?
Oh, I would have to say that I get calls probably, 10 times a week, 12 times a week from seniors who, very often they'll say, I have this book. I don't even know where I got it. I've had it for 1.5 or 2 years now, but I'm thinking there must be a new one. And so, of course, I send them a new book. And, that conversation always includes statements about this book is amazing. It is so helpful to us. And we are so grateful that someone's doing this. We didn't, we had nothing like this prior to finding Seniors BlueBook. And it is very useful. So that is what I come to work for every day.
I love that you have an excellent web presence, and that's great for the children.
Excuse me, but I was just going to shut that off. I'm not sure.
It's great to have an excellent web presence, and that's great for the children of seniors. But seniors themselves aren't always on the internet, so it's
Pardon me, just 1 second.
Sure.
Okay, sorry about that.
That's okay. It's live. It happens. It's really great to have an actual book because a lot of seniors, even if they have a computer, they don't even want to go on the computer. They don't have to look things up on the computer. So that's great for the kids of the seniors, but for seniors, they like a book.
It's very portable.
Yeah. And
it's a digest size. So we all remember Reader's Digest. This is the size of a Reader's Digest.
Do you have those good jokes in it, Carol?
I don't. No jokes. It's all pretty serious stuff.
Yeah.
And a lot of articles
too. Jokes in it. That would be fun.
Yeah. Yeah, that you have a point there. Everybody could use a little humor, right? Wish I'd thought of that a few months ago.
Another one's
Because
coming
now
up.
we really all need humor.
Oh, I know, I know. No, but this is a great resource, and people need to know what's happening, especially during this time, because people are very concerned about what to do with their senior and what's safe. Where is it safe? Where is it safe? You know, should they be moving somebody now? Also, what I have a friend that's been waiting for months to move her mom in because she doesn't want to move her mom somewhere. Her mother's 91, is Alzheimer's. She doesn't want to move her in somewhere and have her locked in a room for 2 weeks in a strange place. So she wants to know what's safe. Like, is a place going to do just a double negative test and let my mother be free there? If not, she's not moving her in yet.
Right.
So it's good to have a resource, and you could call all the places and see what's the availability and what are you doing now.
Mm-hmm.
You know, so I love it.
We offer a free referral line too.
Oh, tell us about that.
So, you know, there's if you're on our website and you have questions, you can type in a question and it will be answered by the person at our help desk out in Colorado. She will do her best to answer it, but if it's too specific to the market for her to be able to answer it, you know, really accurately, then she simply refers it to, and you know, for Connecticut, she refers it to me, and I follow up with the.
That is a great feature.
Yeah, we do try very hard to make sure that the information that we provide is very specific to what someone is telling us that they need. So
Well,
it's very stressful to be in a situation. People don't usually start doing their research until there's a bit of a crisis with a senior. That's what always seems to prompt the initial need for change.
well, Carol, I love that it seems like you do this from the heart. This is something
I
that
do.
you love. I mean, you're even taking calls to individually help seniors. I love that. So it's not just a business for you. It's definitely something that speaks to your heart, and that's probably why you're doing so well at it. And I applaud you for that, because that's what it takes to do well at anything. If something speaks to your heart.
I do feel very passionately about what I do.
Yeah, it's a great service, a great service. And you must have a lot of like new nurses and new people that are just like, wow, this is the best thing ever.
Yes. So now that we're talking about nurses, so we also publish a separate edition that's 8.5 by 11 with a 3-hole punch down the side. And you can see here, this is called the Discharge Planner's Resource Notebook. So this edition is formatted specifically to the needs of case managers who are putting a care plan together for a senior who's getting ready to leave a hospital, or a social worker at a skilled nursing who's planning next steps for a senior. And all of the information that I was explaining is in this book, but we put it in the 8.5 by 11 format with a 3-hole punch. So because case managers and social workers use binders, and so it makes it very portable for them. And this is also very valuable to advertisers, because the people using this information are great influencers for them.
That's beautiful. That's a great addition. So not only do you have all the seniors, then you have a special edition just for nurses.
For case managers and social workers, yes. It's
Wow.
called the Discharge Planner's Resource Notebook. And they are also extremely appreciative of the information that's available to them. It saves them time. It's efficient to use. And it goes to the case management office at every single hospital, and to the social services department at every skilled nursing in 65 towns.
Yes, because they're like little social workers, right? Somebody goes in
They
there.
are social workers. That's what they are, yes.
Yeah, they fall, break a hip, you can't go back home. Now you're at the care. Now you have to do something.
Yeah. They need to put together a care plan. Yeah. Mm-hmm.
That cannot be easy. And like you say, in an emergency situation.
Right.
So you're making it easy for them.
Yes. And they also are extremely appreciative of it. It's such important distribution for me too, to have that vote of confidence in the data that we print.
That is amazing. This is like a godsend to so many people.
Thank you.
It's a beautiful thing. And I wish it was in every state, not just in 28. It should be everywhere. I think,
Yes.
I remember when a friend of mine got cancer about 10 years ago, and she made binders of research. Binders. She kept research and all different things and alternative medicines and everything she did. And then when somebody else she knew got cancer, she had the binders for them. So this is kind of like an elaborate, binder system of compiling everything we know. And
It is.
Yeah. So, and you check on everything. You have to check every single source off and make sure everything is still good.
Yep. With each edition, we send that information out to the contacts that gave it to us, and sometimes it changes, and we have to make a call because the email that we have on record, the listing update didn't reach them. It is a time-consuming process.
A labor of love, as they say.
It is, yeah. It's important to make sure that it's accurate data.
A labor of love. Well, thank you so much, Carol. Anything else you want to tell us about the book and about the Blue Book and where we can get it? So people can get the Blue Book by calling you or
Right.
going to Blue Book, Senior BlueBook.
Yes.
.com.
Yep.
Can they
Right.
get a copy if they go on there too?
Yes. They would leave a message, type in a message, and it would reach me. Yes. Yep.
Very nice. Well, this is excellent information. I think
Okay. I do have one more thing to add.
Yes.
God willing, we are going to get back to some level of new normal. So a very large part of what we do is events. So we partner primarily with communities, with senior living communities.
Uh-huh.
And when they have a grand opening, or there's a new team on board, or, a summer party, we collaborate with them. Our list of contacts is extensive. It's a highly coveted list, about 2,000 names of Connecticut people who work in the senior care industry. And so it makes for a very successful attendance when they partner with us. So I hope that we will eventually be back on track there to
Yes. So when people are doing a grand opening or have a major event or put an addition on to their senior living or whatever it is, that you can send out emails and partner with them, and then you're there giving out the books, I assume.
Oh, of course. Yeah. But
That's
usually it's kind of it's a celebratory kind of atmosphere, and it's a great opportunity for people who work in the senior care industry to foster their relationships with their colleagues.
So are you missing that part of it right now?
I do love that part of it. It's very social, and yes, I enjoy it.
I think we're all missing the social aspect of life right now.
Yeah. Yes.
It's not fun, but I'm sure we'll get back on track. If not this year, by next year, we'll be back on track. And I look forward to you being at some of my events.
Yes. We can put something together for dog residential home for seniors. Yes.
I would love that. Look at all that you're just telling me right here and now. I'm learning so much more. Thank you, Carol. Well, if anybody's interested in talking to Carol about receiving a book for free, or if you're a home healthcare provider or a nurse or anybody in the industry, definitely give her a call if you don't already have your hands on a copy. New one's coming out in a week.
Yes.
So we will be ready to receive with open arms. And I cannot wait for it to come out. And I thank you so much for publishing this, for being who you are, for loving what you do so much. And it's just fantastic for the community.
And thank you, Deborah, very much for giving me the opportunity to tell you about Seniors Blue Book.
You are so welcome. Thank you so much. I hope you come on again, and good success with the book. And thank you, everybody. And I'm going to say goodbye to you now. And we will talk to you again real soon, Carol. Thank you so much, Carol. That was Carol from Senior Blue Book. If you're interested in getting a copy, please give her a call or go online right here to seniorbluebook.com. What incredible information she has to share. Wow. And talk about loving what you do. That is We should all have our heart in everything that we do, and that's why she does so well at it and really cares about seniors. Even if you're confused at what you're reading or looking at or have additional questions, you can just call Carol and she will help answer them for you. Doesn't get better than that. Well, everybody, I'm wishing you a fantastic 4th of July weekend, Independence Day. We're so happy here in the United States to still have our independence, even though it may be a little bit at home right now. It's still a great freedom that we enjoy. So I thank everybody, and I look forward to seeing you on Monday. Till then.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe, safe, safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.